when you all first came to us, is it called a drink from a fire hose? It's been nicknamed that. So you'll see what's coming at you. But today for our training, you're going to get a drink from a garden hose. And we cut it down a little bit because the only reason we have this overview for everyone is because getting in and having a system pushed on you and you're only looking at certain things in the system, it's like putting together a 1,000-piece puzzle without the box in front of you. So today we give you a snapshot of the box, and then we start chunking it down. So when you see all this stuff flying at you, just know that you don't need to take notes. We're going to explain it all in future trainings. When departments come to us, the different group heads, accreditation coordinators especially, they kind of look like this when they first start out. And it's like, oh my gosh, you know, I'm taking on all these different projects and programs. Well, the dashboard, when implemented, we're hoping we're going to make it a little bit more chill and kind of look like this. And yeah, as if you guys always have time to file your hoofs, you know, during work time. So the dashboard was originally designed, I was telling Brandon, as an operational planning and execution system. So as you're looking through this, you know, the main purpose is, okay, your strategic plan, getting you familiar with all the different aspects and elements and how to monitor it in the system. And this is what the director at Maricopa County, which was a large jurisdiction here in Arizona, wanted to do, and wanted it all in one system. And being able to have that quality improvement portion built into the system. Then in 2011, when FAB came along, lo and behold, they had a fully demonstrated performance management system. And really important portion of the FAB accreditation or any part of your strategic plan is to be able to have every level of your department get involved in the organizational success. And then also being able to pull in external partners and get them involved as well. We define performance management. If you Googled it, you go on AI, you'll have a zillion different definitions. We bring it down to 3 steps. So that's how we define it. And one, the first step is creating a good operational plan. This is your strategic plan, and make it operational. All that is a specific group of people doing a specific activity in a specific time frame. And with that said, after we build the plan and we start executing the plan, we want to be able to monitor it. It's all good said and done when we monitor it on the macro level, you know, getting a snapshot of what that group or that division is doing or the whole department. But what we want to do is catch anything that might go awry in your plans in real time as soon as possible. So we monitor it on the micro level as well. So that would be, you know, someone who is in charge or a group lead for an objective, being able to monitor every element, the objective level, the activity level. It could be that, you know, someone's out on leave, so you weren't able to make this objective the time frame that you had set before you, or there might be not enough widgets to install and not enough vaccines or whatnot. So you, as the folks that are going to be working with it, are going to be able to communicate that to any kind of group lead through that micro level and the macro level. Then we have a web link ability where you can create a report to show to the community how you are doing on your strategic plan or how you are doing on your CHIP, your CHOP. So the third step to performance management is that quality improvement or the performance improvement. So that means that you're going to make your plan, you're going to execute your plan, and then through your dashboards, you're going to be able to check your plan, communicate, and then make your adjustments and then go back into the plan. And when Fred here is going to open up the dashboard, you're going to see some navigational tabs going from left to right. And we'll give you the pyramid to show you the hierarchy of these tabs. So that first tab that you will see is going to be your department. The next tab that you'll see are going to be the different groups, offices, programs in your department. And those groups could be a program. Those groups can be accreditation, CHIP, CHA, workforce development. Underneath each group, those groups are going to have their own set of services and initiatives, what they're planning on doing in the future. And underneath each service and initiative, they're going to have their own set of goals, objectives, and activities. Now, I kind of slowed down my pace, and the only reason why is because I kind of slowed down Fred. He thinks that breathing is overrated. So he goes pretty fast, and we have forced him to put in screens and say, do you have any questions? And by the way, he deserves it. He developed the whole kit and caboodle here. So are you ready, Fred?
I'm ready, Andrew. Thank you so much.
Okie doke.
Okay. So what we're going to do now is we're actually going to walk through those 3 phases Andrew talked about. We're going to develop an operational plan. We use the example of tobacco cessation. We're going to develop the plan. Then we're going to monitor the plan through its life cycle so we can see the micro level performance monitoring, the macro level, and then show how we might share it with the public using VMSG Public. And then we're going to take it through the PDCA cycle to see how we would make improvements. Now, this can apply to any plan that you have in a system. It could be one of the standard plans like you see up here in the bubbles. These are what FAB calls their 6-pack of plans. These are the minimum required plans for accreditation. But you can have plans for anything in a system. You can manage grants. You can manage WIC. You can manage viruses. You can or vaccines. You can kind of manage anything you want in the system. So you can develop any number of plans at any level in the system here. So we have this little demo organization we call USA Public Health, and I will take you live into the system now. So when you log in, if you guys haven't logged in yet, you're going to see a screen similar to this. And depending on the permissions you have as to how many of these buttons you'll see down here. But these are the tabs Andrew was talking about across the top. So as I navigate across the tabs from left to right, I'm basically going down the pyramid. So my organization is my health department. My groups is the structure of the health department. Services and initiatives for each group, then goals, objectives, and activities. So I'm going to go to my groups tab here. And I'm going to go down here. As you can see, I'm selected at community health. So for today, I'm going to be the community health director. Now, under community health, you can see we have tobacco and WIC. These levels over here indicate the hierarchy. So the number 1 level, the top level is your department. Underneath that, you might have something like your strategic plans reporting directly to the department. You have administrative services division at level 2, which would report to the level 1 department. And then you can see underneath that, you have 3 groups at a level 3, finance, HR, and IT, reporting to the level 2 group. So it's hierarchy, and it can go to 10 levels deep, which nobody's ever gotten to. I think 5 or 6 is the most anybody's got to, even in very, very large departments. So I'm going to go down and select my group, Tobacco 2023. So this is our group of tobacco programs. Now, since I've selected this group, when I go to the next tab down, which is services or initiatives, they're going to be the services and initiatives specifically for the tobacco group. So I'll click on that, and you'll see we have 3 of them up here: tobacco cessation, secondhand smoke, and tobacco initiation prevention. So these are maybe 3 of the big buckets of things we've been working on within a tobacco program. Now we talk about services or initiatives. So services are ongoing things. So I use the example of WIC. WIC is something we've been doing forever and something we'll continue to do forever. For today's demonstration, we're going to assume that tobacco cessation is a new program we're rolling out, or an initiative, we call it. And really the big differentiator here is this checkbox down here. When we get down to the bottom level at the activities, we're going to have future dates versus current dates, but we're going to call this an initiative. Underneath tobacco cessation as the initiative, then we're going to have a set of goals. Goals are a high-level definition of what we're trying to accomplish here. So in this case, you can see we have reduce smoking in high schools, reduce smoking in colleges, reduce smoking in public areas. Now, this gives you an idea of what we're trying to do without the detail. So we say reduce smoking in high schools. Well, we don't say which high schools. We don't say how much we're going to reduce it. We don't say when we're going to do it. So at this point in time, we're just giving you the idea of what we're trying to accomplish. Now, you can also see at this point in time, we've assigned a traffic light here. So the traffic light just makes a nice visual indication of how we're doing in this particular area, in this case, reduce smoking in high schools. And it's just like you'd expect. Green is go. Everything is moving along as expected. Yellow would be something slowing down. Maybe somebody's retiring at the end of the month and responsible for the program, something along that line. Red would be something came to a screeching halt, something bad happened and stopped the program. The gold bar that you see indicates successful completion of this portion of the plan. So when you get to some things, and some things like reducing smoking in high schools may never be completed, unless you get to the point where nobody's smoking, which would be great, right? But at this point in time, we're saying if the portion of the plan can be completed, we may mark it as gold in here. And you'll see the traffic lights at the goal, objective, and activity level. The other thing we have over here at these levels are notes. So I can go in and put in a note. And what I'm doing basically is communicating with anybody else who might be looking at this particular goal in this case. Now, this little button right here just basically puts a date and time stamp and a person stamp, if you will. So the date, the time, and who's actually putting in the notes. So it helps you to identify who's doing what in the program. The other thing we have down here is a data source. What we did is we built the data source in to allow you to have a link right to whatever website might be the source of data that you're going to use to update this plan. So you can see it's the CDC Smoking Cessation Fast Facts website. And this little link over here is what takes me there. So I click on that, and it's going to open up a new browser tab and take me right to CDC Smoking Cessation Fast Facts. And this may be the area that I'm going to go to get the information to update the plan. So the nice thing about that is you can have that information at your fingertips without having to go search for it every time. So that is the goal level down here. Now, underneath each goal, we're going to have a set of what we call SMART objectives. Our nomenclature is SMART is specific, measurable, attainable, realistic, and time-based. We kind of usually don't think much about attainable and realistic because if they're not attainable or they're not realistic, why would you go after them? So think about specific, measurable, and time-based. So here's an example. We're going to reduce smoking at Wayne High School by 25% by the end of the school year. So it's very, very specific. Reduce smoking at Wayne High School. It's measurable. 25% is our measurement in here. Our time base is by the end of the school year. So it's a very finite target that we've just set. Now, in order to get us to that target, we're going to assign this person we call the objective lead. You can see Steve Hansen is our objective lead. Steve's got two basic jobs. Number one is to get us to this 25% reduction. And number two is to keep this particular objective up to date. So down here, what is our current status? What is our current percent reduction? Just in case you can see it's 25%. Now, if I wanted to change this objective lead, I just click on the little down arrow here. And then right now, Steve is the only person in the tobacco group, is why he's the only one showing up. But if I show all users, it's going to show me everybody in the department. This is our little demo department here. So everybody in the department. I'm going to leave Steve as our objective lead in here. Go away. Thank you. So the objective lead, again, got two jobs: get us to the target. So the program manager, project manager, and to keep this particular objective up to date. And we'll talk about the real-time planning in a few minutes here. And that is an automated email notification that'll go out to Steve, typically on a monthly basis. You can set whatever you want, but typically a monthly basis. Steve will get the email, have a link to go back into the system through what we call the quick update screens, and be able to update this very, very efficiently. Again, we'll go into more detail in that in a few minutes here. So again, we have the notes over here. We have the time and date stamp for the notes, and we have the ability to create a data source specifically for this particular objective. Now, under the objective, we have what we call activities. Some people call them action steps. These are the steps we're going to go through that we believe will get us to that target. And there's three different types of activities in the system here. Project-based activities, by far the most common, probably 80 or 85% of what you'll see in there are project-based activities. And that's exactly what it is. It's a project. We're going to accomplish this in a given time frame. The next type of activity, the QA activity, we'll talk about in a few minutes here, and a QM activity. We have examples of each of these I'll go through for you. But our project-based activity is create training content and materials for students and faculty on the dangers of smoking. So we're going to create PowerPoints. We're going to create maybe some videos, maybe some user guides, that sort of thing. Every activity has got a performance metric or a target. And what we're saying is, how do I know when I've successfully completed the activity? So if we're creating training content, once we've created the training content, hey, we're done with the activity, and hence the reason it's marked as gold here. Now, every activity has got a beginning date and an ending date, and these are dynamic. Things happen in the real world. COVID happened and pushed bunches of programs back by years, actually. So you might be updating these dates as you move forward. Ideally, you're trying to get this content created within this date range. Our measurement on this particular activity is over here. It's percent complete. Now, when we go into the next level training, which is operational planning, There's a lot more detail we'll go into it about setting up these activities differently and things. But for now, the default is 0 to 100%. So in this case, you can see we completed chapter 1, and you look in the notes and there's 4 chapters total. So this is probably sitting at 25%, and chapter 2, 50, 75, and 100%. So that's how we're measuring the success of this particular activity. Now, the other thing you're going to be doing a lot of, especially if you're going into your strategic plan or whatever, is you're going to attach team members and team leads. And that's what this little pencil icon right here is. Click on that. Again, Steve is the only guy in the tobacco group. So I'm going to hit the little black X here to open it up to the whole department. Now, we have 3 columns here. Team members, exactly that. These are the folks who are actually creating the training content. The team lead, so Diane Cox is the leader of this team to create the training content. And then the email notification. This is that real-time planning. So Diane is going to also get an email. Steve will get an email. Diane will get an email to go back into this particular activity and update the status. So how far along is she in creating the training content? And you're going to select those. You're going to hit the little save button down here, and it's going to save the new status. You can have as many team members as you want, 1 team lead, and typically 1 email notification, although you can have multiple email notifications. This column over here, FTE, full-time equivalent. This is just the ability to track how much human investment you're making in a particular activity. So you can see we have Diane at a 0.1, or about 10% of her time, William, same thing, and then Andrea at about 30% of her time. So what we're saying is, what we're doing is calculating the cost of doing this activity. Typically, this is only used during budgeting cycles or trying to figure out how much grant money do we need to do this program, so you can actually calculate it that way. Now, what we do with that FTE value is we roll it up the pyramid. So down here, you'll see the 0.1, 0.1, 0.3 for these folks rolls up to a 0.5 at the activity level. If I take all 3 of these activities and roll them up to their objective, you'll see down here we have a 1.0 FTE down here at the objective level. So it's about a full-time person's job, broken across several people to get this smoking reduction accomplished here. So that's our internal team. We also have the ability to assign external partners. So this little button down here will take me there. So you can see we've assigned our external partner as VMSG dashboard. That's the partner organization on the left. Within the organization, you can have as many contacts as you want. In this case, we just have Fred as the contact within VMSG dashboard. So what we're saying is that Fred is our contact at VMSG dashboard to help us create this training content. Now, there is an option that you can make Fred a system user, which then allows you to assign Fred to be the email recipient. So think about that. If you've got a good partner you're working with a lot, they would probably be willing to learn to go back into the system, and we'll train them at no cost to you guys to do that. We'll train them to go back in and update these particular activity that they're assigned to. So instead of you having to play phone tag, voicemail tag, email tag with somebody collecting the information, going back and finding the activity and updating it, we can short circuit that cycle. Fred can go directly back in, again, through a limited quick update interface, update the activity he's been assigned to, and you're all done there. So that's your external partners. So that is our first activity here, is to create the training content. Now, our second activity is we're going to take that training content and we're going to provide 9 training sessions. Pardon me. We're going to provide 9 training sessions each month on the dangers of smoking to students and faculty. This is what we call a QA, or quality assurance activity. Here's the uniqueness of that. Number 1, you'll notice it has a start date but no end date. The reason for that is we have what we call a frequency here. In this case, we got the frequency set to monthly. It can be anywhere between weekly and every 5 years, actually. But we're saying we're going to do a monthly cycle starting on 11/1. So at the end of November will be the end of that cycle. So it calculates the end date, if you will, for you. And then we're going to move into December, work in December, and January, et cetera. So what we're actually doing is measuring within that cycle. So in this case, it makes sense. We're going to do 9 training sessions each month within the program here. Now, the other thing that this one does that's unique is it automatically sets a traffic light. So in this case, we know that if we get to 9 training sessions, that's our target. So that ought to be green. If we only get to 6 or less, we've set that target in there. It can be anything you want, but we set it for 6. If we only get to 6, we're going to say that light's going to be red. And then in between there, it's going to be yellow. So you notice our value is sitting at 8 down here in the bottom right. So we've done 8 training sessions. So we're not quite to the green yet. So we're at yellow. The other traffic lights are set manually with one exception. And that is on the project-based activity, when you get to 100%, it sets it to gold automatically for you. So this is our second activity, is provide those 9 training sessions each month. Then our third activity is, in parallel with doing the training, we're going to go out and contact all 20 tobacco vendors within 1 mile of Wayne High School to ensure they're not selling to minors. Now, this particular activity is called a quantitative measure because we're actually measuring a quantity. In this case, we're looking for 20 tobacco vendors. So it's very, very similar to the project-based activity. But if we have a specific target number that we're working with, we just use this type of activity so it can automatically calculate your percent done for you. So you notice down here, we're running at 20 tobacco vendors contacted. It says we're 100% done. If this was sitting at 10 tobacco vendors, it would obviously be 50% done. So those are the 3 activities that we believe are going to get us to that target of a 25% reduction at Wayne High School. Now, let's go back and look at that in the pyramid. So our group was Tobacco 2023. The initiative we selected was tobacco cessation. The one goal we selected was to reduce smoking in high schools. Our SMART objective was to reduce smoking at Wayne High School by 25% by the end of the school year. And then the steps we're going to go through to get there. Create the training, provide the 9 training sessions a month, and contact the local tobacco vendors. So that's the planning process. Every plan fits into this exact same model. And the benefit of that is once you create the first plan, you know how to do it. And that's what we go through in the next training, is how to create an operational plan in the system. You've got that model all the way down. So every plan is the same. When you're comparing plans, you're looking across plans. When you're evaluating plans, when you're updating plans, it's always in the same model. We have seen so many different planning models across public health over the last 15 years. It really is nice when you get down to a single model so everybody can focus on the plan rather than the planning model here. Now, we've got the plan in place. Let's go walk it through the PDCA cycle. So this is where we're going to do potential quality improvement. So we've got the plan. Next thing we're going to do, obviously, is execute the plan. So in this particular plan, we're going to finish creating the training content. Once we're done with that, we're going to take that training content and go out and do the training at the schools. And then in parallel with that, we're going to go contact those 20 tobacco vendors. This is where that real-time planning comes in. Again, real-time planning is an automated email notification. Typically, it's set for a monthly cycle, like I say. So on a monthly basis, you're going to get an email from the system. There's a link in that email that'll take you right back into what we call the quick update system, which we'll go into in a few minutes here. The quick update system then allows you to very effectively update the status of the particular objectives or activities that you've been assigned, so you can keep that information in real time. The reason that's critical is because the check phase is comparing our plan to our actual. So in this case, we have a plan of 25% reduction at Wayne High School. And we're going to go back now, and through what we call micro level performance monitoring, we're going to be able to look at the status of that particular objective. And to do that, the easiest way is just to click on this little button here, the chart. And what it shows us is over time, we started, when we kicked off the plan, we started at 0% reduction and ramped up and got to our 25% reduction. So our plan was 25, our actual here is 25. Looks like we're in great shape. This is, again, what we call micro level performance monitoring. So now, the reason that is so easy to do is because we're collecting that information in the background with the real-time planning. If you're not doing that, you've got to go out every time you do the check phase, you got to go out and find out from Steve, what is our current percent reduction? If it's not where you want it to be, you got to go talk to Diane, you got to go talk to William about where are we in doing the training, where are we in, contacting tobacco vendors, et cetera. So let the people who are actually doing the activities out there update the system on a real-time basis. So all you have to do is push that button and look at it and say, hey, we're good. Now, after the check phase, you're going to go into the adjust phase. The adjust phase, there's kind of 4 different scenarios in here. The first one you just saw. We had a plan of 25, actual 25, everything's working beautifully, don't need to change a thing. We'll bypass the plan change here, continue with the execution, go back and check it every once in a while based on the information we're collecting in the background here, continue through the cycle. Now, let's assume for a second that when we looked at that chart, it only got to 21% and not 25, and it capped off at 21%. So what we know now is we're not making our target. So there's a couple of different options here. Perhaps we were just a little overzealous in setting that target. Maybe 25 is really too much to expect at this point in time. So maybe 21 is the right number. So potentially we could change the plan to 21, continue through the cycle, try to keep it at that 21%. The other thing we could do is if we believe that we can get to that 25% target, we might need to throw more things to do at it, if you will. And the word just slipped my mind here, but it'll come back here. So what we're going to do is adjust the resources. That's the word I was looking for. So in this case, what we're going to be able to do is say, maybe if we did more training sessions, or maybe there's more tobacco vendors out there to contact, or maybe there's a third or another item out there that we hadn't thought of that we can do to get in there. So at this point in time, you get your choice. No adjustment necessary, as you saw in the first one. Potentially, you could adjust the plan if it makes sense to do that. You can adjust the resources if the resources will get you to your plan. And then the fourth option would be potentially that we can adjust the plan and the resources. So maybe we think we can get to 23 if we throw a little bit of additional resource at it. So we'll take the plan down to 23. We'll take our resources to maybe 12 training sessions a month. We think that'll get us to our 23% reduction. So that's the PDCA cycle. Every plan in the system is going through this cycle all the time. Ideally, you're collecting that information from what I call the horse's mouth, those people who are actually doing the activities. Now, some people have implemented it where they go to the supervisor to get that information. Well, the supervisor is not necessarily always 100% in tune with what every employee is doing in real time. So they're going to have to go ask the employee, say, hey, how many training sessions did you do this month? Come back in, find the activity and update it, versus go right to that person. In this case, I think it was William who was doing the training sessions, and let William go in. He knows exactly how many he's done because he's the guy doing it in here. He's going to be able to do it the most efficiently and the most accurately. So in an ideal world, everything goes right down to those people here. So that's the PDCA cycle. Now, we talked about micro level. That was the chart you saw. We also have what we call macro level performance monitoring. That's what we call the dashboard here. So I'll take you back into the system again. So the dashboard is based on the selected group. So again, as I mentioned, I'm the community health director today. When I log into the system, my default group is community health. So it takes me right to community health. And what I'm going to be able to want to do at this point in time is just see how is community health performing here. So I just click on the little traffic light up here in the top right corner. It takes it about 10, 12 seconds to gather up all the data in the background. And what it's going to do is build me a succinct summary screen of community health. How is community health performing? Also, it's going to include the first level subgroups under community health. The reason for that is you got WIC and you got tobacco under community health. The folks who are running WIC and tobacco are probably reporting directly to the community health director. So if I'm the community health director, I want to know how is my whole sphere of influence performing today. So here's what we're seeing up here. Top left corner, I call the big picture. And basically it's the number of traffic lights in each color. And you'll notice that I get the little click finger when I roll over it here, meaning I can drill down on this red activity or these 5 yellow activities and get right down to the data without having to go search for it or anything. I can look at any of the 3 bottom levels of the pyramid, so my goals, objectives, or activities. And then the schedule gauge is saying, as of right now, for these 23 activities, we are aggregately 1 day ahead of schedule. The way that that's calculated is pretty simple. We've got a beginning date, ending date, and a percent complete. So it's just going to be able to calculate whether we're ahead of schedule or behind schedule. Some of these activities could be behind, some of them ahead, but aggregately, we're about 1 day ahead of schedule. If you wanted to find out more, you could, again, drill down on those particular activities and look at the actual data in there and figure out where they are. So that's my first view is my top left corner. When I want to drill down even further, I've got 3 different views down here. I got my leaders. So these are the either activity or objective leads that you've selected up here. I've got my groups. So in this case, it would show community health, WIC, and tobacco down here. And then my third one is my priorities. Priorities are the strategic priorities from your strategic plan mapped against everything else in the system. The idea there is to make sure that everything you're doing is in fact rolling up into your strategic plan, which is kind of the goal of it here. Well, so what I see down here under activity leads, so these are my people. The first column you see over here is when did they do that last update? Remember the real-time planning in here. I want everybody to be within 30 days, which is green. If they slip out a little bit, maybe they're on vacation that last week of the month or something. So they slipped a week, they go into yellow. But when you go into red, that means I haven't updated in 60 days. So yellow is 30 to 60, green is under 30, and red is over 60. So at this point in time, I'm probably going to want to have a chat with Mara and maybe put her through the training on how to do the quick update so she can get in there more often or something. Now, there's an old adage that says people listen to what you say People do what you audit. This is kind of a mini audit here. So if I'm the community health director and I'm having my monthly meeting with my staff and I throw this up on the big screen up here and I explain to everybody what this column's all about, that, I need to have as much real-time information as possible in order to manage community health here. I will guarantee you that the next meeting, every one of these will be green. So just a kind of a background little audit, if you will. Here's that FTE column rolled up by person. So how loaded is each person based on the FTE assignments we did? Lagging just says I have activities that are calculated to be behind schedule. The days column is the same as the schedule gauge up here, but for the individual person. So in this case, you can see Diane is 32 days ahead of schedule aggregately for all of her activities, and Andrea is 24 days behind schedule. Overdue says I have an activity that today is past the ending date of the activity. So maybe I had an activity that was, maybe it was October 31st was the ending date on the activity. Here we are at November 1st, it's overdue. And then the number of red, yellow, green, and gold for that person. So again, that's my first view is my people. Then I can see the same information here for groups or priorities. Top right corner, my priorities. Individually selectable objectives that you personally want to keep your eye on. When you select these on the objective screen, there's a little green flag you set. We go into that in the performance monitoring training. You go into the detail of that, and basically you're bringing these up to this bookmark up here. So that's basically what it is, a bookmark for the objectives that you want to keep your eye on. Now, typically you're looking at yellows and reds because if they're green and gold, they're on track or completed in here. And typically you're looking at things either that you're working on personally or your team is working on, and you just want to keep them front and center up there. These lights, by the way, are real time. So if somebody in the background goes in and changes it to a green and completes the activity, or a gold, you can click on that, uncheck the little flag, and it goes away. Again, these are on your login only. Everybody can pick the same ones or they can pick different ones. So that's the macro level of the dashboard screen. Now, over COVID, we had a lot of extra time while you guys are out saving the world. And what we decided to do is take a lot of feedback we'd have from different health departments over the years on features that they wanted to add to the system. One of those was VMSG Mobile, the ability to do a lot of these features and functions on your phone. Now, the cool thing about this app is you don't need to have IT's permission or anything to be able to put it on your phone because it's not really an app. It actually is what we call a dynamic app, meaning that it builds the app in the web browser on your phone when you log in. So you go to the same login link, use the same login credentials. It knows it's a phone and it builds it into the phone. So what we did is took that same screen you just saw, broke it down into 3 phone screens due to real estate. Top left corner, bottom, top right corner. Same functionality. I can drill down on anything on here. I can change my priorities, objectives on here if I want to. So just for those of you who aren't in the office all the time in front of a computer, you got the same functions here. So basically what we just went through is the core functionality of the VMSG dashboard, and particularly performance management. Now, most of the folks like yourselves are actually going through accreditation. You guys are actually going through 2 accreditation processes, with the Cycle 8 and the FAB accreditation process. But for those people who are using our system, and there's about 240 departments across the nation using the system, if you put that FAB 6-pack of plans in there, we have all the accreditation plans built in. So the operational plan for doing accreditation is in there. So using that plan and using the real-time planning to meet measure 9.1.6, which says basically you got to involve everybody in the department. That's what the real-time planning does. Every one of those folks has gotten what FAB calls fully demonstrated for performance management, which is their highest level of compliance. So again, FAB is one of the things you can do. You can manage documents, you can have the dashboards, you can update plans, you can build any kind of a plan in the world that you want. So that's the basic functions. Now, I'm going to go through a list of additional functions that we'll be getting into in the additional training modules, but I just want you to kind of have an understanding of what the different functions are here. So intelligent document management used to be just document management. And the reason it was put in there is because when you go through the accreditation process, you're going to submit somewhere between 300 and 1,000 documents up into what they call the EFAB system, for those of you who aren't familiar with the accreditation process. And ideally, it's a fairly long cycle. Sometimes accreditation can be a couple years, re-accreditation is a 5-year cycle, and you're collecting documents the whole time. So we basically built document management into the system to allow you to attach the documents into the accreditation plan so you know where they are, you know when they expire, you know exactly what's in the document. Now, a couple of months ago, we had one of our health departments up in Michigan, actually, came to us and said, we got a problem we think you can help us solve. We have a bunch of standard operating procedures, memos of understanding, policies. The thing that they all have in common is they all have to be updated on a regular basis. Typically it's annually, but sometimes it's more or less than that. And then we typically have a group of people who are responsible for doing those updates. What we don't have is something in between that says John has to update this standard operating procedure every year. So what we did is built a function into that QA activity, the quality assurance activity, that allows you to set a timeline. In this case, it might be a year, and then set a percent to yellow. And maybe you set it for 80% of the year. So 9.5 months into the year, the light turns yellow. John gets notified to go in and do the update. He downloads the document. He does his update, uploads the new document, does version control for him automatically, sets the light back to green, starts a new annual cycle. If he gets to the end of the year, the light turns red, everybody gets notified that the document's not updated in there. So it really is a cool tool. We've got so much great feedback from people in using this now to do exactly that. Manage policy, any kind of critical documents you need to manage over a period of time. Lots and lots of reports in the system. We go into great detail in the performance monitoring training on reporting. VMSG Public is the way to very easily and interactively create public-facing web pages around any planning elements of the system at any level. So I could say, I want to summarize all of the activities for the strategic plan in its entirety over there. You can build what we call an indicator row for that. You can look at each of the strategic priorities in the plan, build an indicator row for that. So, and again, we go into this in the performance monitoring training. Three-dimensional planning. This is kind of a cool tool. What it is like putting a big umbrella over every other plan in the system and being able to gather information across plans. So there's, where you got commonalities, where you're doing kind of the same thing in a couple of different groups maybe, or there's gaps. Maybe you're not doing something in there or overlap. So what it does is basically allow you to look across all the plans for those commonalities. Real-time planning, we're going to go into more detail here in a second. That is the email notification system. All the accreditation plans are in there. So for those of you who are involved in accreditation, we're using the FAB 2022 accreditation plan as we speak right now in your system, and it's all pretty much assigned out to people and stuff. So these are the additional functions that we're going over in the follow-on training, but I do want to dig a little deeper into a couple of things. Number one, the real-time planning, why it's important, and how you actually use it. And then for those of you who have not had the opportunity to log in and change your password, I'm going to walk you through that process. And then when you log in, how you get to the quick update, how you do the updates on quick update. And by the way, that'll cover the needs of most of the people in the department. So let's talk about real-time planning. So this is the way it works. You set up the time frame that you want. Typically, like I say, it's monthly. It can be anywhere between daily and monthly, but you definitely don't want to do daily or people come shooting at you. So let's say we have it set up for the first Monday of the month. So the first Monday of the month at 1 a.m., the system goes in and looks at everybody you designated as an activity lead or an objective lead, and it asks 3 questions. Number 1, has this person been in and updated their stuff in the last 30 days? Number 2, does this person have anything that has fallen behind schedule? Remember that calculation, beginning date, ending date, percent complete. And number 3, does this person have anything that's overdue? It's past the ending date. If none of those are true, no emails go out, so no spam. If any of them are true, out go the emails. And as we mentioned earlier, the emails can go to internal folks as well as external partners. In that email is a link. Now, because you've been designated as an activity or an objective lead, or you wouldn't be getting this email anyhow, you're going to get a dialogue when you log in. It says, do you want to go to the main menu or do you want to go to the quick update screen? We're going to talk about going to a quick update now. So there's 2 screens for quick update, activities and objectives. You go through those screens for your designated activities and objectives and you log out. And just to give you a number, across the, like I say, 240 plus health departments using the system, this average is about 3 to 5 minutes per person per month. So it's an extremely efficient way to collect that information. So you as the managers who are actually managing the plans do not have to go back and collect the information every time you want to do that check phase in there. So that's the real-time planning. Now, the activities quick update screen looks like this. It looks a lot more complex than it is. The reason is that everything up here in the top in the blue is merely the top of the pyramid. So it's context. Which group, service, goal, objective, activity are we looking at? And realistically, there's only 3 things that you're going to update. I'm going to flip through my traffic lights here so I can cycle through the 4 lights with my mouse. I can put in the data value. So How many tobacco vendors did I contact? How many training sessions did I do? What's my percent complete on my training documents and such? I can put in a note in here. Again, you can see the date and time stamp on the note. And then I can hit the next button here to go to my next activity, cycle through my activities. By the way, there's a lot of times when nothing has changed. So you're just going to cycle through that activity. You can look at it and say, nope, nothing's changed. And then when you get to the end of your activities, there's an objective quick update screen. You're going to go through and then you're going to log out. I'm actually going to walk you through that process here in a minute. So the automated reminder email will look like this. Here's those 3 criteria that I mentioned as to why I got it. As an FYI, for all the activities you personally have been assigned, here's the traffic light status. Your system administrators will appear here on the email. So it'll have Queasy and it'll have Tiffany and everybody in here. So if you got any questions, here's how you contact them. And then the link. This login.vmsgdashboard.com will take you right to the login for the system here. What I'm going to do is 2 things. For those of you who haven't logged in, I know some of you have. If you haven't logged in yet, I'm going to walk you through just a set of bullet steps on a screen. Here's how we do it. And then I'm going to go live and walk you through actually how to do it in there. And then Queasy and Tiffany and everybody have a PDF document that they can send you that is the steps for logging in, just in case you don't write all this down, and you don't need to. So logging in, number 1, the link that you go to is login.vmsgdashboard.com. Alternately, you can just go to vmsgdashboard.com, and in the top right corner of the screen, you'll see it says already a VMSG user. Click here, takes you right to this link. There's going to be a dialog box with 3 buttons on it. You want to be able to hit the send button, which means send me my login credentials. You're going to put in your email address in the next box that shows up and hit send again. Hopefully you'll get the dialog that says success. What that means is I found your email address. You have an account in the system, and I just sent you the email. The email goes out almost immediately. So if you don't get it within like a minute, either refresh your Outlook or whatever you're using in there, or go check in your spam filter here. If you don't get the success dialog, contact me. I'll get it fixed for you here. Now, the next thing you're going to do, there's going to be a login button on the screen you're going to click on. And again, I'm going to walk you through all this here. Click the login button. This time you're going to enter the user ID that was in the email that you got. Or if you don't want to learn a new user ID, just use your email address. Typically, the user ID is first name dot last name. But if you want to just use your email address as your user ID, knock yourself out. And then you're going to enter the password. I would recommend initially that you copy and paste the password out of the email, because it will contain some cryptic characters in there. Sometimes it's hard to recognize what they are. So copy and paste, put it in there, and then hit login. Now, let's go ahead and, first of all, this is what that credentials email will look like. Real simple. Here's your login information. Here's your user ID. Again, you can forget that if you want to and just put in your email address, and then you're going to have a crazy cryptic password in there. Again, copy and paste into the system ideally. So let's go and do that in real time here. So this is my log out button in the top right corner, the red power button up here. I'll click on that. I'm going to go ahead and log off. And this is the VMSG dashboard homepage. As I mentioned up here, already a VMSG dashboard user. Log in here. I'll click here. It's going to take me to that login dialog box. And then here's the send button I was talking about. So I'm going to go ahead and hit the send button. I'm going to put in my email address. And I'm going to turn all my caps lock off. And I'll hit send again. Hopefully I'll get the success dialog. Yep. So success, your user ID and password have been emailed to, and give you the email address. I'm going to hit OK. Now, I've got my information in my email. I'm going to go back up and click the login button here again. I'm going to open the same dialog. In this case, I'm just going to put in my username and password, and I'm going to hit login. Now, this is the dialog, and you'll only get this if you've been designated as an objective or an activity lead. The main menu is where we've been working all day, so you can go back there if you want to, or you can just use the quick update. Quick update will take you to initially the activities quick update screen for the activities that you've been assigned only. So you're just going to go through the ones. So up here it says I'm on activity 1 of 8. Again, the group, service, goal, objective, for context, the activity, and then down here, I can cycle through my activities with my mouse. I can put in my data value. I can put in a note. I can time and date stamp the note right here. I can have access to the data source if it's been designated for you in here, or I can designate it here. Put in my data source, click on the link, opens a new browser window. So I have the source of data I'm going to use to update this. Now, the first thing you're probably going to want to do is change your password. So here's the password button up here. I click on that. I'm going to copy and paste out of the email the current password, put in whatever I want for my new password, verify it like every other website in the world, and then I'm going to hit update. So my password is now changed. There's also a button if you're on the main menu. I think it's the 7th item down that's password, and it gives you exactly the same dialog box to do that. So now, as I update my activities, I'm going to go ahead and hit the next button down here. Next button. I'm going to cycle through all 8 of my activities. And again, sometimes you're going to go through and nothing has changed. So you just continue on through it. Sometimes you're going to make a change to, again, traffic light, notes, or data value, cycle through. So I'm on activity 8 of 8. I'm on my last activity here. When I click the button now, it says, hey, you're also an objective lead here. So I'm going to click the objectives button. It's going to take me to a similar screen, but I'm going to have my objective up here. So reduce smoking at Desert Vista High School. So what I'm looking at now is the objective. Again, traffic light, data value, notes, next, next, next. Now you'll notice that the activities that report up to that objective are right below it here. You may also notice that you got one of them down here in blue and 2 of them in gray. The blue means that it has been assigned to you. So you're the objective lead as well as the activity lead for this particular activity of contacting 20 tobacco vendors, which means you just went through it. You've already updated. Don't need to touch it. The gray means that you have probably assigned these activities to somebody else. Now, maybe that person is on vacation and you want to go in and do the update anyhow. So you can click on that. You'll get a little dialog boxes. Do you want to do the update for John Doe or whoever it happens to be in there? You'll say yes and go and do the update. And then you're going to cycle through. I only have one objective assigned to me. I'll cycle through. It'll say, hey, do you want to go back to the main menu, or do you want to go to activities, or do you want to log out? I can always log out from up here as well. Now here's the main menu button. The main menu button is going to take me to exactly the main menu. And then as we talked about, here's the password change button. So it's 1, 2, 3, 4, 5, 6, 7's one down. I remembered. So I can click on that. It's going to give me the same dialogue as I had before in there to change your password. So that is the quick update system in there. Now, one of the other things that we built into the VMSG mobile is quick update. So you'll notice there's a lot less context due to screen real estate. But here's an example I use. I'm driving into the office in the morning. It's that first Monday of the month. I want to stop at Starbucks and have a coffee on the way in. So I'm sitting there, pop open my phone. Here's the email from VMSG. I click on the link in the email. I put in my login credentials. I select quick update, and it gives me the activities quick update screen. So I can go in and say, oh yeah, I know what this is. I'll update it, cycle through my activities. If I'm an objective lead, I'll go to my objectives. I'll cycle through those. I'll log out, and I'm done for the month. So it's just a very efficient way to do it, even, again, while you're not in the office in there. Now, one other thing I wanted to show you here is the built-in help and information and training. So if some people like to do online learning, some people like to do live learning. We do both. Let's go back into here. So let's say I'm at my services tab here, and I have a question about anything down here. So all I need to do is go to the blue eye in the top right corner up here, click on that. It's context sensitive help. So it took me right to where I was, adding and managing services. If I scroll up and down through here, I'm going to get to see how to do everything on that screen in a bullet kind of fashion here, and a definition of all the different buttons that are on that screen in there. So that's one way to look at it. The second way is there's a training video specifically on services initiatives right here. It's typically about 5 minutes long. This button down here is the entire user guide. So everything you see in here in a hyperlink PDF file. Down here is a document. It's called Implementation Guidelines. And what it is something that we've updated over the years from feedback from clients on just all kinds of different things. So there's some how to engage your staff in there, what type of people to start with when you're rolling the system out. Here's some templates on developing operational plans, which we'll use in the next training. There's some IT issues in here around firewalls and email notifications and that sort of thing. Just lots of good stuff. And if you have just started with the system, you want to learn more about what's gone on over the years and what things you can do, feel free to read that. The training is all up in here. So this is the one we're going through. The introduction is one we went through today, so you can skip over that. The next one you might want to go to is the basics, which is kind of every button and every screen defined. Operational plan development is the next typical live training that we do, and that is how do I develop an operational plan? What do the different levels look like? How do I know which level's which? How do I know what nomenclature to use? All that kind of stuff. And then we actually go in and enter a plan. At the end of that session, we assign you homework, and that is to go create a simple little operational plan, as simple as you can do it. And it doesn't have to even be business. It can be, I'm going to plan my Las Vegas vacation. I'm going to plan to see my kids in Phoenix. I'm going to have a birthday party for my youngest, whatever it happens to be. We've had all kinds of cool things in there. So you're going to create an operational plan. The idea here is to understand the levels of the pyramid. So, what is a SMART objective? What are the activities that'll get me to that objective, that sort of thing. And then we have another session that's a review. And that is, we're going to go back and look at every plan that you've either put in the system or put into a template or scratched on a piece of paper, whatever you want to do, walk through those. If you don't have it in the system, we're going to give you control and let you enter it in the system, and we'll help you to go through that so people learn better that way. So it's a nice training session for operational planning. The next training session will be performance monitoring, and that is every chart and graph, VMSG public, all the reports, all that kind of stuff, and how they all lay out, that sort of thing. So if you like online learning, these are video-based training modules. If you go through just these three, the admin levels just for those folks who are designated as org admin to manage users and permissions and that sort of thing. But these three, I think, are about 2 hours and 15 minutes if you want to go through them. Again, we're going to go through these live in future sessions as well. So that is the help and training here. So that is what I wanted to cover today. Are there any questions or anything else that I can show you?
Ta-da! Oh, I work so hard.
Oh, you did a great job.
So Fred, I just got access today and I had already logged in and I was able to go through some of this information with you as you went across. Some of my screens don't look the same as what yours were either though. So even with my password notification, I had to change my password, but it was a different look entirely. Like I didn't have the little icon at the top. It was in a drop down when I went to the main menu. So up in the top right next to the power button where you're logging out, you have your information and then you have your menu. And when you select the menu, it gives you all that information. You're able to change the password there. Why is my system not showing up the way that yours did with the little icons where you selected change password right in the middle of your screen?
That's when you log in, you probably are not yet assigned to any activities or objectives. So the only people—
Well, it looks like I am, according to what it is when I go into it and go into the organization. I do have a specific task for our Patagonia health record that was assigned to me. So I do have things that have been assigned that I can get into.
Okay.
But I'm just seeing it a little differently. So I'm guessing that's just user navigation. I was able to change my password. I just couldn't do it where you showed me. I had to go through another mechanism.
Yeah, that's the quick update screen. And remember, the three criteria to get to quick update are you haven't updated it in 30 days. And if you've just been assigned and you haven't, it's behind schedule or it's overdue. If none of those are true, you won't go to a quick update. And that's where that button was up there on the quick update screen. Now the top—
Okay, and yeah, when I click on it now in that main thing, I can see it and it shows me the strategic plan and the one that's assigned to me. And I see the keys now located here, but they're just different outside of where they were from the main menu. So that's helpful to be able to see that. Again, this is my first time in the system seeing it, so I want to make sure I know where I'm going.
Yeah, now everybody has different user permissions too. So you'll see probably less buttons on the main screen than I would on my screen.
Good. I don't need more buttons.
Good.
Anything else? Anybody else have any questions?
Yeah, and by the way, you guys can email us anytime. If you have a question, please feel free to reach out. And then the next training, I believe, is it already set up, Fred?
I do not know. I'd have to look.
Okay, I'll get with them. And then the next one would be the operational plan and development, where we get into all those tools to help you with that strategic plan and then assigning activities and so on and so forth.
Okay.
I have one last question. Thank you for the training. I did sign in and I'm trying to figure out if we are already assigned groups, because it seems like I'm assigned to a different group than I'm supposed to.
You
And
would be
I'm wondering if
a
that's
default
something that
group.
is set up in the back end, or I need to talk with Chrissy and Tiffany.
Hang on a second. Let me log in and look at your account here so I can see what groups you're assigned to.
He has the power,
I have the superpowers.
All the power.
Yeah, but don't tell
all
them.
the power.
I try to use them wisely.
And just to be clear, when I go to the dashboard, next to the status summary, the groups that you see on the blue box there is the groups that you're assigned to. Am I interpreting that correctly?
Well, I'm going to show you here in a second what permissions you have and what group is your default group here. So give me a second here, if you would, please.
He's going down the list of all the health departments, and then he'll pick out yours and then go down to your group.
Okay.
Yeah, so these are the different groups. So let me look at your user permissions.
Yeah. There you go. You're in your department.
And scroll down the list here. Katarina, okay. Yeah, you're designated as a read-only user, Katarina. And that's something, you know, if you need to be able to update information in the system, you need to talk to Queasy and they'll reset that. Your default group is EPI. So when you log
Yeah,
in,
okay.
EPI.
Yeah, I'll follow up with him.
Yeah, get with Queasy. Read-only users can only look and do reporting. They can't actually edit anything in the system. So if you need to be able to update anything, get with Queasy and we can change that to a normal user and you can update anything.
Okay, sounds good. Thank you.
I'm glad you caught that, Katarina.
Say that again.
I'm glad you caught that.
Yeah, I was like, I was
Because-
going through the different tabs. I'm like, I cannot do anything. So
Yeah, there's probably nothing
If you
under
need
the EPI group right now.
important, so
And the
I'll-
permissions
I'll,
level, when you were showing that, just for clarification again, because I saw 1, 2s, 3s, I wasn't looking at myself on that, but I was seeing some of the other users. What does that level, 1 being the highest access point, 3 being the lowest? What is that permissions level on?
Let me show you here the
class
different
activity.
level. So user is the normal user. That's, you know, got kind of permissions to change things. You can't delete things at a higher level, things along that line. The next level up would be manager, which would be a number 5 in that permissions group over there. They have they can update more. They have more permissions. They can delete higher up the pyramid. Org admin is the highest level, so they can pretty much do anything in the system. And then we have partner users. Partner users can only update 3 fields on a screen when they get access to do it. So they can't change the plan. They can just change the values in the objective or activity. And then like Katarina was a read-only user, meaning she can just look at things, but she can't change anything in the system. So that's the different levels permissions.
Great, thanks.
You're certainly welcome.
thank you.
And Queasy has full access to be able to set all those. Okay, everybody, I will be sending a link to the recording for this. If you have any other folks that need to see this again, or we'll be happy to do it again. I'll be sending this to Queasy. Thank you, everybody, for your time today. Have a wonderful day.
you guys have a
Thank
great
you,
rest.
we appreciate it.
You're certainly welcome.
Bye.
Bye bye.